Hello, this is EK. I haven't put out a video in quite a while, so this is the first probably in a long time. I'm going to talk today about setting up a home health agency. For several years, I was a consultant in home health. I still do a little bit of consulting, but not at the same level like I used to. I wanted to guide people as to what to do when you first think of setting up a business as a home health agency or hospice or PAS only, which is provider only services. The first thing is to think of a name, and whatever name you pick, ensure that it contains the business you do because your name is your first advertisement. So if it's a home health agency, ABC Home Health Services Inc., that will announce what you do. It will not be okay to just say ABC Inc. If it's a hospice, it's actually a requirement that the word hospice is included in the name. So after you pick a name, then you decide on a business structure. Do you want a corporation or an LLC or a partnership or a sole proprietorship? So let me say a little bit about the advantages and disadvantages of each of these. The corporation has ironclad liability, which means a lot of protection. If there's a problem, let's say one of your employees does something, there's a lot of liability protection for a corporation. However, taxes are a little on the high side. For an LLC, the taxes are a little lower, the protection may be a little lower also. Partnerships are good, but I usually don't recommend it quite a bit because in my many years of consulting, I have found out that partners tend to fall out after a few years, and then that creates a whole new set of problems. The final setup is a sole proprietorship. That means that the official name or the legal name of the business will be your private name, your personal first and last name, then doing business as whatever, like ABC Home Health. So it would be Carter Brown doing business as ABC Home Health. You would have to go to the courthouse to register a sole proprietorship. So after you get a name and a business structure, the next thing to do is get a tax ID. Your tax ID should reflect the name of the business. So if it's a sole proprietorship, the legal name is your name. Don't ever forget that. But if it's an LLC or corporation, you get a tax ID in the LLC name. A lawyer can get your tax ID for you, a CPA can get your tax ID, or you can do it yourself by going to the IRS website. Then you need to get two separate phone numbers. One will be your phone line for the business, and the other will be a fax line. I know that there's not a lot of faxes used these days. People do emails and some other ways to transmit documents. But for doctor's orders or some of the other documents that people still receive quite a bit by fax, for that reason, you will need to get a fax. Then you need to assemble your personnel. Um, Depending on the type of home health agency you're trying to set up, if it's a PAS only, which means Personal Assistance Services Agency, you do not need nurses there. You need an administrator and an alternate administrator. The requirement is that each of these persons would have worked in a facility or with people with disabilities for a period of time. The requirements are on the website of Texas Department of Health and Human Services. So for PAS only services, which is provider services, you do not need a nurse in the agency. You only need an administrator and an alternate. For the Medicare level home health agency, which means there's a category on the license that says licensed and certified. That is a Medicare agency. The certified means certification, Medicare certification. You would need two RNs. The first RN is the director of nursing, and the other RN is the alternate director of nursing. If these RNs also have past experience as administrators in an agency, they can also be administrator and alternate administrators. So the personnel you need. And then before you apply for a license, a Home and Community Support Services Agency license, HCSA for short, you need to do two things. You get a letter of good standing from the controller if you are a corporation or an LLC. The other thing is that the administrator and the alternate administrator, both of them, have to register separately and do the pre-survey conference with the Texas Department of Health and Human Services. They also have to get their initial 8 clock hours of administrator training. I have that on my website at nurseonlinelearning.com. Because the certificate or the proof of the initial 8 clock hours and the proof of the pre-survey conference with Texas Department of Health and Human Services have to be included when you try to apply to TDHS, Texas Department of Health and Human Services. You go on their website and the TULIP online application. TULIP stands for Texas Unified Licensure Information Portal. You go in there and you do your application online and you send it to TULIP. The fees are also listed. I don't want to give you figures because those fees change sometimes. So just to do a quick recap, to set up a home health agency, get a name and make sure the name includes the type of business you will be doing. That's advertisement on its own. Get a structure, whether you want to do an LLC or a corporation or a sole proprietorship. Get a tax ID for the business. Get 2 separate phone lines. Assemble your personnel. Do the pre-survey conference for the administrator and alternate administrator. Do the initial 8 clock hours of administrator training and get the certificates. And then you can go on TULIP and do the application to the Department of Health and Human Services. I think that concludes all I want to say about that. There are 4 applications in total that you will do if you're trying to set up a Medicare level agency that has licensed and certified home health. TULIP is the first one, where you go on the Department of Health and Human Services website. The second application is to CMS, the 855A. This is the Medicare application. You pay fees. I also don't want to talk about fees. It used to be 500 and something, but I don't want to give figures because those change. Then you do your CLIA application, Clinical Laboratory Improvement Amendments. And finally, after all of those are clear, you would either choose the Joint Commission or CHAP, a Community Health Accreditation Partner. I've done a lot of CHAP agencies and a few Joint Commission agencies because those are the bodies that now do the initial survey for certification for Medicare. Our Department of Health and Human Services stopped doing those in 2006. So if you're going to start a Medicare business, you have to do an application to the Department of Health and Human Services, to Medicare, CMS, to CLIA for your lab so that you can do finger sticks and some other blood tests in the house, and finally to the accrediting body that will do your initial survey for certification. Hopefully I covered the essential parts of setting up an agency. If you have any questions, feel free to ask me. Don't forget to subscribe and remember to like. Thank you.